Hi, I'm Brittany Montez, and this is the Orlando Health News Review for July 27th. U.S. News & World Report, the global authority in hospital rankings and consumer advice, has named Orlando Health Dr. P. Phillips Hospital, Orlando Health Health Central Hospital, Orlando Health Orlando Regional Medical Center, Orlando Health South Lake Hospital, Orlando Health South Seminole Hospital, and Bayfront Health St. Petersburg as 2022-2023 high-performing hospitals in a total of 12 categories. In the U.S. News & World Report 22-23 regional ranking of hospitals, Orlando Health also ranked number 8 in Florida and number 2 in the Orlando metro area. The 6 Orlando Health facilities received high-performing ratings for the following medical specialties. Congratulations! And Orlando Health and UCF Go Baby Go recently participated in a bill to adapt motorized cars for children with special mobility needs.
As clinicians and a healthcare community, we get to just give a family something. And for families, I think it's the time that they get to focus on not all the things that are challenges for their child, but they get to focus on their strengths.
The UCF Go Baby Go event held at Orlando Health OMC featured a workshop for parents to join in to help customize and decorate tiny cars to help their children zoom along the road to independence and exploration. Once the tailor-made cars were complete, the little drivers raced under a checkered flag. Orlando Health Arnold Palmer annually donates to support the UCF Go Baby Go program due to the program's focus on the pediatric population. And last week, Orlando Health Arnold Palmer worked with the Orange County Fire Rescue Department's Special Operations Program to conduct a structural collapse drill.
We want to work together with you guys and really practice a mock scenario to better prepare for pediatric trauma scenarios. We also have an adult patient as well, so kind of a collaborative event with ORMC as well. We're trying to actually study the impact of a mock scenario on your actual skill level and ability to perform in a real pediatric trauma. And so we just want to be able to practice that, improve upon further scenarios we do with you all.
Crews simulated a vehicle crash into a building at their training facility, which included the search and rescue efforts of entrapped patients from underneath rubble, as well as patient treatment and transport to Orlando Health Arnold Palmer.
This is a drill that we do a lot of these simulations in the community to work with our pre-hospital providers in how to care for children and how we can best take care of children. It's a great collaboration. These are real stressful situations for both ends of the teams. We're trying something new today. We're going to be broadcasting the scene to the hospital, and that allows us to anticipate what's coming and to know the severity of the injuries. We do what we do in a well-stocked emergency room with good lighting and good teams. They're out here in the field where it's hot, they have limited resources and whatnot. So it kind of builds the collaboration, builds the respect to do these together, to do them during the light of day in a controlled situation. So when the real event happens, we've done it a multitude of times.
And don't forget to remind your family members to apply before the July 29th deadline for the new Orlando Health Way Scholarship. Thanks to the generosity of the Orlando Health Foundation, Orlando Health's Your Best Place to Work Committee will be awarding $25,000 in scholarships yearly to the children and dependents of Orlando Health and Bayfront Health St. Petersburg team members. Visit SWIFT before July 29th to read more on the Orlando Health Way Scholarship. And now hear about the culture one team created in their department and how their team members embody the Orlando Health Way.
My team embodies the Orlando Health Way by just being creative in their pursuit and care. An example is we had a patient who was graduating from graduate school and couldn't attend his graduation, so our team put together a mock graduation with hats and tassels, and we had him walk down the aisle. It was very moving to the family, and it made a big impact on the patient.
Well, that's it for today's edition of the Orlando Health News Review. We'll see you next week.